Hello everyone, and welcome to our training on administering medications and early education programs, including expectations from the childcare minimum standards. My name is Timothy Smith, and I'm going to be leading this training today. Thank you for using timthetrainer.com. Before we get started, let's go over some helpful training tips to help you be successful. First off, this training has been submitted to the Texas Early Childhood Professional Development System. It does have a course ID number. So make sure that you enter your personal TechPeds ID number on your Tim the Trainer portal before you complete your assessment. That way your certificate of completion will automatically be uploaded into your personal TechPeds account. If you have any questions about the material that we discuss in this training, or if you need more information beyond the scope of the training material, you can always reach out to us on our website in the upper right-hand corner. You can send a direct message, or you can call, or you can email. Again, if you have any questions or if you need more information beyond the scope of the training material, and we can respond in a timely manner with a response. Also, just a reminder, per the childcare minimum standards, all trainings must be completed in a reasonable amount of time. The best way of looking at this is that you cannot complete more clock hours of training in a single day than the total number of hours worked in that day. Definitely, you cannot complete more clock hours of training in a single day than there are waking hours of a day. We just want to make sure that you are in compliance with childcare regulations, with Texas Rising Star and Texas Workforce Commission. So make sure that you're managing how many hours you're completing in a single day to avoid any type of issues. Our objectives for this particular training: we are going to identify the Texas licensing requirements and documentation needed for administering prescriptions and over-the-counter medication. We're going to demonstrate proper procedures for safely storing, handling, and administering medication to the children. And last, recognize when verbal or electronic authorization is acceptable and how to properly document single-dose permissions. Based on those learning objectives, the benefit to the participants will gain the knowledge and confidence to safely and legally administer medication in compliance with the Texas Child Care Licensing Standards, helping ensure the health and well-being of the children in care while reducing the risk of errors or regulatory violations. To get us started, we are going to look at the definitions of medication as outlined in the Child Care Minimum Standards. So childcare licensing is going to define a medication as a prescription medication that has been prescribed to a specific child from a healthcare professional, or it could also be a non-prescription medication, including topical ointments such as diaper ointment, insect repellent, or sunscreen. When looking at non-prescription medication or over-the-counter medication must be given exactly as directed. So you're gonna need to look at the back of that bottle or the packaging to see what is directed. If it says something like consult a physician, you're gonna need documentation from the child's healthcare professional giving specific instructions on the dosage that needs to be given to that particular child. If you have a child that requires a special diet or a child that does not want to eat the food that the center serves, you're going to look at this right here. To serve a child a therapeutic or special diet, you must have written approval from either a physician or healthcare professional with the authority to write prescriptions. if the diet relates to a disability that restricts the child's diet, or a healthcare professional or a registered or licensed dietitian if the diet is not related to a disability that restricts the child's diet. You might be asking, well, what does this have to do with administering medications, and why are we going over, food and food that can and cannot be served, or preferences? You must not serve nutrient concentrates and supplements such as protein powders, liquid protein, vitamins, minerals, and other non-food substances without written instructions as required above. All right, so that's the reason why I included that in this right here. Sometimes we have parents that want to bring in especially protein concentrates or some type of vitamins or minerals. You're going to refer to that standard on 3311. You're basically going to handle it as if it is a medication or a non-prescribed medication in those situations. What authorization must you obtain before administering a medication to a child in your program? First off, I want to address, you do have the option of choosing not to administer medications in your program, but that has to be a policy across the board for all children. If you require to have a no medication policy, basically stating that you do not administer medication, you're going to let families know that, once they enroll in your program. If you choose to have a no medication policy, then, parents have the ability to come up to the facility and administer medication for their child if needed. The only thing to keep in mind with having a no medication policy is that there are certain medications that are considered a reasonable accommodation to a special care need and have protection under the Americans with Disability Act. In these situations, if the medication is specifically for a special care need or a disability, in those situations you would have to administer that medication, such as behavioral management drugs, breathing treatments, nebulizers, blood sugar testing for children with diabetes. These would be some examples of reasonable accommodations to a special care need or a disability. You might also be asking, why would a program consider not having a no medication policy? Well, giving medication to children creates a large risk for your program. The risk of giving the wrong dosage, the risk of giving the medication to the wrong child, the risk of overdosing a child, being unaware of medication that may have been given at home already, miscommunication between individuals who are administering medication. There's a lot of risk. Therefore, from general liability purposes, very strict policies and procedures need to be put in place in order to administer medication. All right? You get to choose how to write these policies and processes. If you're an employee at your facility, when you're done with this training, this is going to be a big homework assignment for you to review your individual center's policy and processes on administering medication, and who in your program is designated to give medication. I strongly recommend this be limited to a very small number of individuals that are authorized to give medication in your program. You don't want too many hands in the pot, all right? So the fewer number of people that are authorized to give medication, the better, okay? I also just want to share with you some of the most popular policies that we tend to see in giving medication. Usually I see schools that if a child needs a medication once a day, the parents can do that at home. There is no reason for you to take on the risk and the liability if it's only given once a day and the parent or guardian can give that at home. Even if it's a medication that is given twice a day, once again, the parent or guardian can give the medication before they bring them in. They can give them the medication once they get home. There is no reason for you or your facility to take on that risk in that situation as well. The policy that I typically see and the policy that I have used in my schools is that we only give medication that is prescribed 3 or more times a day, and we will only give the middle dose. All right, so once again, mom, dad, guardian can give the first and the third at home. We will give the middle. That is the most popular policy. But again, check with your individual facility on what your policies and processes are and follow those policies accordingly. Now, in order to give a medication in your program, all right, you must get that authorization from the child's parent or guardian. Needs to be in writing, signed, and dated. All right. Many of you are using medication logs. There is actually a sample medication log that you can download from Child Care Regulations website. It's actually a pretty good document. I recommend it. And that can be used to get that written authorization. I do encourage you to have a binder with page dividers, and you only have the parent sign in their medication for their particular child on an individual piece of paper. So I don't recommend having a medication log with multiple different children's names and medications on one sheet of paper. Each individual child has their own medication log. This is going to help you with privacy violations, all right? You can never expose an individual's health condition to the public. And so when you have a medication log that has multiple children on one log, then when a parent is signing that medication in, they are seeing other children's information. That could be a privacy violation. So you might want to reflect on that. All right. If that authorization is coming to you in an electronic format, all right, then it needs to be done in a way that can be viewed and saved safely. Or if you are allowing by telephone to administer a single dose of medication, document that phone call. And I recommend that when the parent does come in that afternoon that you get a signature at that point. I'm going to be honest with y'all. I'm not a big fan of number 2 and number 3. All right, allowing electronic authorization or allowing telephone authorization. I prefer you to get this in writing. Documentation is the key to success. If it's not written down, it didn't happen. And getting those signatures from the parent. So if you are allowing the electronic format or the telephone authorization, follow it up with the written authorization when the parent comes in that afternoon. If you allow parents to leave medication at your facility, then it expires on the first anniversary of the date the authorization is provided, okay? And then the authorization form expires on the first anniversary date. So you're going to need to get a new authorization form every single year. And this is typically for reoccurring medications, something that a child would get every single day, no matter what, is really what they're talking about right here. If it is your amoxicillin, those type of medicines that are treating a specific medical condition, you're probably going to get a new authorization anytime the child is given a new prescription. All right. The child's parent may not authorize you to administer medication in excess of the medication's labeling instructions or the directions of the healthcare professional. So in other words, a parent cannot change the dosage. You're going to administer that medication exactly as prescribed or exactly as directed by the child's healthcare professional. The parent or guardian cannot change that. So that's going to be important for you to pay attention to. When you're getting the authorization to administer medication, you're going to want to cross-reference that with the prescription that's on the label or on the box that they're bringing in. All right. Parent authorization is not required if you are administering a medication to a child in a medical emergency to prevent the death or serious bodily injury of the child, provided that you administer the medication as prescribed or as directed or intended. So in other words, in a severe, life-threatening emergency situation, you're going to do what's best for that child at that moment. And you're going to be okay in that situation, just again, as long as it's given exactly as prescribed, directed, or intended. Steps to administering medication in your program. Once again, medication must be administered exactly as stated on the label directions, or if it has been amended in writing by the child's healthcare professional, and you're going to get that document in writing. Be very careful accepting documentation that may say something like a child can be given a pain reliever as needed, or allergy medication as needed. If you receive documentation from a healthcare professional and that is how it is worded, I would send that back and say we need more information. We have seen court cases where the court has come back and asked a school to prove who in their facility is trained, certified, and licensed to determine when a medication is as needed, right? And unless you have a registered nurse or healthcare professional on staff, I think it's pretty safe to assume that nobody in your facility has that certification or education to determine when something is quote unquote as needed. So if you have a parent that brings in that documentation and that's all it says, give medication as needed, I would send that back and ask for more descriptive information. Okay, medication must be in the original container, labeled with that particular child's name and the date that it was brought into the operation. You've got to be careful right here because from time to time we have families that want to send in medication that was actually prescribed to a sibling or another member of the household. It has to be for that particular child. Probably one of the biggest deficiencies right here is the documentation of the date that the medication was brought into the program. So that needs to be clearly dated on the authorization form, and I would actually write it onto the medication. Again, medication must be administered only to the child that it is intended for. Must not be administered past an expiration date. So once again, you need to clearly look for this. There have been lots of situations where parents and guardians have brought in expired medication. You're going to need to watch this, all right? And just because a parent sends in expired medication does not make it okay. So if you see that the medication is expired, you're going to send it right back with the parent, okay? When you are administering medication in your program, you're going to document the full name of the child that the medication was given to, the name of the medication, the date, time, and amount of medication given, and cross-reference that. Make sure that the amount given matches the amount that was prescribed or directed by the healthcare professional. and then the full name of the employee administering the medication. And this does need to be the full name of the employee, not initials. You must keep documentation of all medication records for at least 3 months after administering the medication. This is what's required by child care regulations. But when we look at document retention techniques and what is best practices, we're going to encourage you to keep that documentation much, much longer than 3 months. Any record or document that pertains to a child, my recommendation is that you keep that indefinitely. When storing medication, you must store medication out of the reach of children in a locked storage container, and you must be able to store medication in a manner that it does not contaminate or come into contact with food. If the medication needs to be refrigerated, then you must keep the medication separate from food that is being served to the children or employee lunches that are being brought in from home. This is not only a requirement by child care regulations, but is also a requirement by your local and county health departments. So you have 2 different regulatory agencies that is going to look to see if medication is coming into contact with food in your program. It's going to talk to you about how long may you keep medication that you administer to a child. You must dispose of the medication or return it to the parent when the child withdraws from your program, or when the medication is out of date or is no longer required for the child. And that last part is what I really want you to focus on. Needs to be returned to the parent or disposed of as soon as the medication is no longer required for the child. My recommendation to you for best practice is to send medication home with the family every night, all right? Rather than you storing the medication in your program, send it home every night. They bring it in the next morning and sign it in once again. The only exception to that is, again, if you have a medication that's given every single day, no matter what the health condition is of the child. In those situations, we can store medication in the program. The reason why I encourage you to send medication home every single day is to prevent medication from being left behind. We see a lot of situations where medication is left at the facility. The child is no longer taking it. Next thing you know, you've got this giant tub full of medication, and then it starts to expire. And then the moment it expires, licensing or your local health department comes in, you get a deficiency for having expired medication, or you get a deficiency for having medication on site that a child is no longer taking. It is just easier and better to send it home every day. All right. If you do choose to have that non-medication policy that we discussed at the beginning of the webinar, then obviously you're going to inform parents of this policy in writing prior to the child's enrollment. So they need to be made aware that you don't administer medications if that is the case. I also wanted to add into this training what the standards and regulations say about specialized medical assistance. So specialized medical assistance is any medical assistance other than medication. Examples include, but not limited to, assisting with apnea monitors, protective helmets, or leg braces. Probably the most common thing that we see in early education programs is the protective helmet. So your requirements regarding specialized medical assistance, if a child in your care requires specialized medical assistance, then you are required to provide specialized medical assistance as recommended or as ordered by the healthcare professional. If you are provided with a written copy of the healthcare professional's recommendations or orders, you must maintain this written information in the child's records for at least 3 months after the healthcare professional has indicated the specialized medical assistance is no longer needed. Once again, I'm going to encourage you to keep that documentation much longer. I would keep it indefinitely if I were you. This is a piece of legislation that was passed by our lawmakers here in Texas, that we are required to support children with specialized medical assistance. However, if there is a direct threat to the safety of that child or the other children in care, or if this is preventing the child from participating comfortably in the program's activities, there may be some situations where you can exclude a child at that point, but I would not make that decision until you seek legal counsel and make sure that all of your documentation is obtained, all of your ducks are in a row. We definitely want to accommodate children with specialized medical assistance, but there are many other factors that have to be looked at in order to keep not just that child, but all of the other children safe. Now, you're not done yet. Don't stop this video just yet. You have a little bit of a homework assignment that needs to be completed before you do your assessment on administering medications in early education programs, including expectations from the child care minimum standards. First off, you need to review your individual programs, policies, and processes on administering medication. Second, you need to identify who in your program is authorized to give medications. And I also want you to review your documentation process. So how is medication authorized in your program? And where is this information stored so that if you need to see this in an emergency situation to properly care for the children, you will have the information needed to assist in those significant events. If you have any questions regarding the information in this training, or if you need more information beyond the scope of the training material, remember you can message us right there from our website. You can email, you can call, and we are here to assist you and give you more information beyond the scope of the training material if needed. Now again, don't forget to do your little homework assignment. What are your policies and processes for administering medication in your program? Who is authorized to give medication in your program? And where is medication authorization stored in your facility? And is it easily accessible to you to be used in the event of an emergency? So those are the 3 things that you need to do before you complete your assessment. All right, everyone. Thank you so much for completing this training. I look forward to seeing you all again very soon.